All right. Hi, everybody. It's Dr. Vanessa with you today, and we're doing Facebook Live again. I realized after a little bit of a hiatus from our our weekly, or sometimes even um, twice or three times a week practice um, of sharing information and meeting with you guys online, that I'm a little bit rusty with setting up the technology, but I am excited to be here. And today's topic is polycystic ovarian syndrome, or PCOS. Um, the cystic reference to the ovaries is not always present for a diagnosis, despite the name. And actually, another name for this condition is chronic anovulatory syndrome. So that means that you're regularly not ovulating. And I'll get into all the details in just a bit. For those who are joining, it's likely that you yourself or you know someone that has this diagnosis, because it's actually the most common endocrine or hormonal condition amongst women of childbearing age. In fact, it affects upwards of 10% of this specific population. So that is 1 in 10 women. So PCOS affects not only your menstrual health, as was already mentioned, but also potentially your overall health, because of the downstream effect of the different components of this condition. And so, just to review, so everyone's on the same page, um, the diagnosis for PCOS is um, anovulatory, or irregular or missed cycles. So something is not normal with your menses. And also hyperandrogenism, which results in something called hirsutism. And that's when women exhibit kind of male physical traits, and that's due to an excess of androgens or male hormones, thus hyperandrogenism. And that can appear like excess hair. It may be on the face or on the body. Um, it can uh, result in a coarsening of facial features, so maybe a stronger jaw, or skin that's like a bit rougher or more prone to breaking out. And another aspect is uh, insulin dysregulation, or some sort of blood sugar imbalance. So you just have to have two or of three of these, and of course, the last factor is actually cysts that are visible on ultrasound on your ovaries. So we've already covered that it's really common condition, the diagnostic criteria, and it's not only just important to treat these symptoms, which will probably be the first sign that you have one of these four things, the blood sugar dysregulation, the excess androgens, the male physical traits from the excess androgens, potentially cystic ovaries, and missed or irregular periods. But what can happen with time if these things aren't addressed is more metabolic and cardiovascular type conditions. And so, with the insulin issue, you can get things like hypertension and lipid type disorders, so excess cholesterol, especially the bad LDL cholesterol, also abdominal obesity, and even things like fatty liver disease. And in fact, by age 40, so women can have PCOS from the time that they start ovulating, from the time that they start their periods. It can be an issue, but if things aren't resolved by around age 40, about half or 40% of women with PCOS will develop prediabetes or diabetes. And so we want to find ways to balance all the things that are contributing to this condition. And to date, there's no conventional medication or cure. It's a lot about just managing the symptoms, and for naturopaths, always getting to the root cause. So for those of you joining, just wanted to emphasize that I'm at your disposal and available to answer any questions. So feel free to drop me a line or just say hi. If you need me to clarify anything, I'll be watching the comments. Okay, so we're going to go back to the anovulatory cycles. How do you know if you're not ovulating? Because actually, you can have something called an anovulatory bleed, which means that you're not ovulating, but you are still seeing something that resembles a menstrual period. And that can be quite confusing because we often use that overt sign to confirm, yes, I got my period this month, it's late, it's early, that's the external sign. But internally, that actually might be caused by an insufficient or low amount of progesterone. So the two important female hormones here are estrogen and progesterone. And in PCOS, there's an excess of estrogen and a deficiency in progesterone. It is one of those estrogen dominant conditions. But funny enough, it actually shows up as an excess of testosterone, or that's some of the more visible signs. So when there's an imbalance of the estrogen and the progesterone, we'll start to see cycle irregularities. So when you don't have enough progesterone, and that happens when you're not ovulating, because there's something called the LH surge, that's the luteinizing hormone surge, that causes ovulation, and that's what creates higher levels of progesterone in the body. So when there's not enough progesterone, that's the hormone that maintains the uterine lining of the uterus. That can lead to heavy bleeding itself without ovulation. And this can be mistaken for a real period. So a really simple solution to this is actually to use ovulation strips. Women often will use these to plan for fertility and conception, but you can use it just to get an inside look at whether you are ovulating normally. And they're really easy to use. You just urinate on a strip, or you can void in a cup and dip it in. And there's usually two lines. There's there's one line, that's the indicator line, that you compare your sample with. And in all the kits that I've encountered, you'll see a darkening of this line when you are ovulating. And once you get to that dark line, that means that you're close to ovulating, or you're actually currently ovulating. And that means that you'll release an egg, an ova, from your fallopian tubes in the next day or day and a half. So within 24 to 36 hours. And it's another confirmatory sign that if you do get that dark line, that in a day or so after that it turns light again. That means, okay, you've ovulated and you're in the later part of your cycle and things are regular. So it's, pretty cost efficient, and we have to urinate anyways, right? So um, ovulation strips is one tip to figure out whether you are ovulating on your very own. Um, and the best time to check for whether you're ovulating is in the late afternoon. Most kits will recommend this, even though this luteinizing hormone, or LH surge that I mentioned, occurs in the morning because we're testing the urine. It takes a few hours for your body to metabolize the hormone and for it to appear in your waste stream. Okay, so now the point about insulin. What can we do about that? So with insulin dysregulation, mostly the things that are recommended for diabetes will also be suitable for this aspect of PCOS. So I have a friend that was diagnosed with PCOS, and her family doctor, her number one recommendation was to lose weight. Um, and that can be really helpful. So even up to a 10% decrease from your current rate can reduce your insulin resistance, or just the sensitivity of your insulin receptors. And insulin is the hormone that helps transport glucose from your bloodstream into your cells. When you have things like insulin resistance, that receptor doesn't pick up on the high levels of glucose that are already in your bloodstream from your diet, which leads to you being hungry and craving carbohydrates. But in fact, you already have plenty of those building blocks. It's just an issue, a defect with that receptor to get it to the cells where it can fuel and satiate you. So weight loss, and then in terms of exercise, that can be one of the hardest things. Of course, the combination of diet and exercise is, the double threat. But especially in hot weather, I've found lately that it can be hard to motivate myself to get moving. Well, what I often tell patients is, it's totally up to you how you want to spend that time exercising. Generally, I would say something in the ballpark of 2.5 to 5 hours a week. If you want to be a weekend warrior and do that on your days off, that works. Or if you want to pace yourself and do 30 minutes a day, but just have that number in mind, that short-term goal. So, if things get in the way and you haven't checked off your hours yet, close to the end of the week, then they're just kind of build up. But if you do have time in your schedule to spread it out and do something that's a little less intense and more manageable, fit it in little pockets, even like 15-minute chunks, that's also just as valid. And okay, so for insulin, some supplements that might be helpful. The ones that come to mind are Chromium, which you could certainly get from a supplement. This is Chromium picolinate. Picolinate is the best absorbable form of chromium. So it is also called a glucose tolerance factor. So it helps increase the use of glucose in your body, and so therefore it sometimes is used in the weight loss community. It just actually makes your metabolism of carbohydrates, proteins, and fats more efficient. It's not, fat burning supplement. It's not going to cause you to lose weight just on its own. It's just optimizing metabolism. And while I'm here, the picture of someone with PCOS is often someone who has more abdominal obesity, and that's a part of the fatty liver disease. I think about 50 to 60% of people with PCOS tend to be overweight, and that's largely due to the effects of excess insulin in the body. But there's also a subtype called thin PCOS. So there are people that have the excess male hormones, the excess insulin, the irregular periods, but they don't associate with PCOS, or they kind of rule it out because the dominant picture is of someone who is overweight, but that's not necessarily true. It's only a slight majority, up to 60%. So you or someone you know could be in that 40% where you're a normal weight or even underweight and still have PCOS. So chromium, certainly you can get it from a supplement, also food. I think the most delicious source of chromium is actually dates. With PCOS, you should be consuming a whole foods diet, very low in refined sugar, processed foods, saturated fats, junk foods. I think all of us know how to eat well generally and avoid these foods. Even simple carbohydrates, anything that's white flour, white rice, white potato, that kind of thing, pastries, cakes, baked goods in general. So eating a whole foods diet does help not only with balancing blood sugar and insulin, but it does help the body detoxify. Detoxification is an important part of PCOS because of the excess cholesterol that can happen, but also because anytime there's a hormonal imbalance, your liver is what's processing or breaking down the hormones into the good and bad types, and shuttling them to the different organs where we can further eliminate them and keep everything balanced. So I want to mention that Dr. Karen and I will be doing another group detox in August 10th to 19th. It's a 10-day program. And Dr. Jeff and I did one already, I think back in May now. And it was really fun. We did it all virtual, and we will continue to do so. And we are going to be having a informational webinar on the metabolic group virtual detox in just less than 2 weeks on July 22nd. And I am going to post a link to where you can register for that Zoom meeting. So we were just talking about chromium, and on top of dates, which is a good kind of whole food source of sweetener. For sweeteners, I would always say to stay away from anything that's processed. So of course you can have whole fruit, things like dates, even plant-based sweeteners like stevia or xylitol, which comes from bark often, or erythritol, but in small amounts. And a whole fruit would be better than juice. if you want some sweetener. So say like some banana, some mashed banana or applesauce. Okay. Um, another Other good sources of chromium are pears and lean sources of protein, specifically seafood, tends to be high in chromium. And that's things like mussels, oysters, and shrimp. And lastly, nuts are also a decent source. So things like Brazil nuts and hazelnuts. Chromium helps with weight loss and improves blood sugar control. Other things include fenugreek. Um, it's a spice that I rarely find a use for, but that is another source of um, improving insulin sensitivity. And you can make a tea with it if you're not sure how to cook with it. It also is a very gentle laxative, actually. So if you tend to be more constipated, a little fenugreek tea can be your source for improving blood sugar and insulin, but also regularity of bowel movements. And the last food thing I'll mention for insulin is bitter melon. Um, per its name, this is a very bitter vegetable. It's kind of like a crinkly cucumber, and I used to turn my nose up at it as a kid, but I've learned to appreciate its bitterness. That doesn't really compare to any other food I've encountered. If you're not a fan, of course, you can always take it as a supplement or a tincture as well. And some top things for decreasing testosterone, the male hormone that gives those coarser facial features, acne, unwanted hair growth, and even hair loss. Alopecia, or male pattern baldness, is actually a excess of testosterone. So things like licorice and an herb called saw palmetto. This helps stop the conversion of testosterone to a stronger form called DHT, or dihydrotestosterone, by inhibiting 5-alpha reductase. And I won't bore you with the pathway details. Just for anyone who wants to know how it works. So licorice, saw palmetto, that can be helpful for any unwanted hair loss, excess hair growth where you don't want it, and acne. And a third thing is spearmint tea. There's really good research on just having simply 3 cups of spearmint tea a day having a significant effect on reducing testosterone in body. And it's delicious. You can always use fresh mint, as I've got here, or there's mint tea bags. Just check that it is spearmint. You know, it tastes a lot like peppermint, but that's what all the research is on spearmint, Menthes spicata. And if you want to bundle it with a green tea, that's even better. Just to recap, PCOS, the things that I hope you take away today are a whole foods diet, and that will help with weight loss and insulin sensitivity. Things like chromium as a supplement or food that's in lean proteins, especially seafood. That's in dates, my favorite source, and also nuts like Brazil nuts and hazelnuts, and certain fruits and vegetables. Pears is one of my top suggestions. Also, to reduce the intensity of testosterone by stopping it being transformed into a more active form. things like licorice and saw palmetto, as well as spearmint tea, licorice tea, and you can probably even find a combination supplement with those things targeted for excess androgens. And then we talked about exercise. Just a 10% decrease in weight can make a difference in terms of insulin sensitivity and weight loss. And using ovulation strips to figure out whether your irregular periods or heavy periods is actually not a normal menstrual cycle, but something that's an ovulatory bleed, because there isn't enough progesterone from the lack of ovulation to maintain that lining. And you can do that with the test strips. You can get those online. You can get them at the drugstore. And in our last few minutes, I just wanted to see if anyone had questions. If you don't, I'll just give another reminder that we are doing a webinar on another group detox on July 22nd at 6:30 p.m. And in terms of balancing hormones, this book by Natasha Turner, who is an ND, The Hormone Diet, her approach to hormones, rather than directly, addressing the reproductive system or the thyroid gland, when there's an abnormality there, usually from lab results or directly from someone's symptoms, is actually to first detoxify the liver and digestive system. And so you can do that with food, and also with a number of detox kits, including the one that we'll be using in our group metabolic detox, to balance stress hormones. So reducing stress, managing stress, and getting adequate sleep. One quick way to adjust the way that you're feeling in the present moment is something that I like to recommend called Mind Gems. And so I just want to teach you one right now. This one is clearing fear and switching on the brain. So when someone has a diagnosis like PCOS, it can be kind of scary to receive a label, but there's actually so many things you can do in your daily life to help manage the symptoms and then the downstream metabolic and cardiovascular effects. And so I encourage you to think proactively, and a way to switch on your brain from getting stuck in that fear state is to cone the fingers of your right hand and touch the left bone at the base of your skull. So there's a bump back here, the occipital ridge, and you're just going to cone your hands and touch the back of it there. And then you'll cone your left hand and do the same thing. So you're touching, I don't know if I'll be able to adequately show you here, like this. And you'll hold that for 12 seconds. I look kind of crazy right now. And just close your eyes and see what sensations or feelings that brings up in your body. That's just one of the mind gems, and the intention is to clear fear and switch on the brain. And then once you've done that once, like that, then you just cross and reverse and do it for another 12 seconds. Okay, so detoxify the liver and digestive system, balance stress hormones, balance the blood sugar, we've talked about that already, via the diet and key supplements, and to replenish nutrients and building blocks for certain hormones. And cholesterol is one of them. We do need some cholesterol. It's the backbone all hormones, but also to kind of quiet some of those hormones that are surging in a condition like PCOS, which can also be done through a nutritive diet. And lastly, of course, addressing what those specific hormone imbalances are. So with PCOS, that's too much insulin, too much testosterone, and also too much estrogen. So if you have any more questions about this, feel free to reach out to any of the doctors at Brio. And a last tip that I have for you today is our Brio bingo game is still on. And you have until July 15th to get your bingo cards in. And word of the wise, it's the honor system. So, if you don't get all the way through the card and just make a commitment to do it later, we're going to be okay with that. Just get your entries in for a chance to win an immune IV or Bowen therapy session. Okay, thank you for joining me today, and I'll catch up with you next time.